Hi, my name is Carrie. I am in the process of fighting colorectal cancer. It was found in the early stage, 1.2 stage, I think, or 2.1 stage, something like that. Very early stage. I have had 6 weeks of chemo, the oral pill form, and 6 weeks of radiation, 5 days a week, every morning for 20 minutes. And I finished it on December 2nd, so I'm approximately 2 months out, 8 or 9 weeks. I feel fine. Feel fully healed. There's been some symptoms, and then I want to cover some of the symptoms or some of the things I talked about in my last video. I mentioned infections. The infections that I had, I believe, were from the ointments and creams and such. I got a urinary tract infection, and my radiation doctor put me on antibiotics, and I had got a yeast infection. I used the regular over-the-counter treatment for that. I did end up getting the UTI again afterwards. So my primary care doctor gave me an extensive high level of antibiotics to really fight it out, get rid of it, get it out of my system. Just so that if my immune system broke down, to protect my immune system or my UTI, or that. There's a couple more things I wanted to talk about. I was very vague on my last video because I was way out of it. I watched it, I felt like I was crazy. I don't know what I was thinking. But they mentioned after your treatments that you will have symptoms and side effects still occurring, and which it was hard for me to understand how that worked, but it is true. There's I do have up days, I have down days. Today feels like a real down day. I see that I'm quite swollen. My face is quite puffy. Uh, um, my insides are a little sore. For some reason, I have days where my digestive system's not really wanting to relax. I did have at 6 weeks, I had my hair down around where the radiation was fell out, oddly enough. But fortunately, for the most part, I have a healthy system. It sounds strange I'm saying that when I'm so sick, but the hair is growing back already. About 8 weeks past the treatment, I had like a heat flare up. Like everything got real hot and sensitive around where the radiation was. Like it felt like I had radiation 2 days ago. I mean, and so that process, that's the chemicals and everything is still working down there. Let's see. One of the things during the treatments I don't think I mentioned was itching. At night I had trouble sleeping, and I don't think I mentioned it in the other videos. So I asked the doctor about it. I wasn't sure if he was going to give me sleeping pills or whatever, but his suggestion was to start off small and use Benadryl. And I did try that, and it did work. And the good thing about using the Benadryl is it did help me sleep. It took the itch away a little bit. And then it didn't affect me where I couldn't get up in the morning and go back in for radiation the next day. Because that was my biggest fear, was getting too many drugs on board and not being able to get up and function. I wanted to keep functioning, to keep healthy. And I did that. That worked out good for me, the Benadryl. And let's see. am right now in baby food, soft food diet. Wednesday, I'll be going on a liquid diet for colon prep for my MRI Thursday, and then that's 13th or 14th of February. And then within the next 2 weeks, I'll have the MRI, the PET scan, and the CAT scan. And on the 27th, I will find the results of that. And we'll be discussing with the surgeon the future treatments and the results of all the tests. Hopefully, I won't need surgery, but that's all up in the air. We really don't know until that day. It's going to be a long wait for me. But that's it. And if you have any questions, let me know.